Yeah, that reminds me, I recently did a focus group with healthcare consumers, patients, and they had some really clear guidance about the kind of information they want and how they'd like to get it from their providers. They said for the regular updates, what are my weight gain trends? Or how's my blood pressure trended over time? All that normal stuff, just general information I need. Yes, I recently tested as borderline for diabetes. You want to educate me about that? I don't need a person to do that for me. In fact, before I ever suggested it, they said, give me a one-stop portal where I can check that. If I can watch some multimedia education that includes video and text. If I have questions, I'll instant message them to you. But you don't have to reply back in real time. And that's all perfect. And so I don't have to interrupt you by calling your office. I don't have to take unscheduled time away from you for the routine stuff. Now, where I need you to talk to me and sit down with me and have a personal conversation is the scary stuff. Abnormal test results, major changes in my health status, something where we really have to have a conversation and make a treatment decision about something that I'm needed. And so we can be smart, and as we work with these practices, really wise about patients are really willing to get a lot of that routine stuff in a way that's time efficient and elevates their experience with that practice and save the people-to-people communication time for those really smart clinicians to have a face-to-face conversation and dialogue.
Yeah, I mean, a lot of it has to do with patient empowerment.
Right.
You need to give them access to their records, and ultimately, health systems are merely custodians of the patient's data. And for the simple things, like you said, patients deserve to have access to that information and make decisions on their own. If I want to file my taxes using software like TurboTax, I should have that right. If I want to book my own travel using, Travelocity, I should have that right. But for the more complicated problems, that means there is greater capacity of real travel agents and real tax professionals to help me when my problems are not so simple.